Hello, I'm Dr. Cynthia Ann Hayes Hurst, acupuncture physician at Serendipity Therapeutic Massage and Bodywork. We will be showing a few videos regarding Oriental medicine, and today's video is about cupping. In the beginning, before we start cupping, we apply lotion. It can be an herbal lotion that's going to benefit the patient. The one that I used this particular time was to help facilitate the movement of the myofascia. The the long gliding strokes are to apply the lotion. It also lets me see where the restrictions are in the tissues so that when I go to apply the cups, we put them on the areas that is going to benefit the most. During this time while I'm applying the lotion and assessing the tissues, I'm also getting to the patient to be comfortable while I work with them. And this helps to engage their parasympathetic system so that they can rest, relax, and benefit from the treatment the most. I'm preparing for the cupping. I use 91% alcohol, and the cupping that I prefer to do is fire cupping. The alcohol on the cotton ball actually removes the air from inside the vacuum, creating the vacuum in the cups. Now, I'm lighting the fires, and you have to have it fairly close to the patient so that you keep that air, you're sucking out the oxygen from the atmosphere that creates that vacuum. If you're too far away from the patient, it's not going to stick to them. So you have to be fairly close to them when you're doing it. There's different size cups. The larger cups are good for larger areas. The smaller cups fit into little smaller areas. And there's a stronger pull. The smaller the cup, the stronger the pull on it. And also, they tend to be warmer because there's such a small space. I've identified a few areas that were particularly tight, and I'm trying to loosen those up. Cupping can be applied a couple different ways. It can be stationary, what they call static cupping, where the cups just stay in position. I have a couple that are just sitting there. And then it also can be used as a moving technique to lift and move the tissues. I'm gliding them off to the sides, trying to loosen the muscles along the sides of the neck and the top of the scapula. On here, now I'm going along the inside of the scapula and then gliding out towards the lats. There's a lot of tightness all along that shoulder girdle. Again, just moving them, just trying to loosen up the fascia. I'm going to put a few more cups on. I've decided to go back around the actual scapula along the top and the base of the neck. Again, I'm still trying to draw the toxins out of the muscles that are deeper down and still trying to loosen the fascia on the surface so that they can move more freely and improve that range of motion.
Now we have a close-up. We can see the skin.
You can see the skin pulled up into the cups. And you can even see the change in the color of the skin on this cup right here. We want the skin to change color because that's showing that the toxins are pulling to the surface. A lot of times, if it's just a very small stagnation, it'll be slightly pink and then it returns to normal skin coloring fairly quickly after you take the cup off. It can progress to being a more moderate stagnation where the redness lasts after the cup is removed. And there's even cases where the cupping marks might be a dark purple, and that dark purple is a severe stagnation. In those situations, patients will feel better initially, but then they'll have a little bit of a gradual residual increase in their pain level, possibly because there's all the things that had been stuck inside the cells are now drawn to the surface, and your lymphatic system has to break it all down and remove it. So the importance of aftercare and cupping is very important because the way that we clear things out of our system is by drinking water. So you need to make sure that after you have cupping done, you stay warm, you stay hydrated. Don't expose yourself to a lot of wind. That includes air conditioning blowing on your neck and shoulders after you've had cupping done. You need to make sure that you pay particular attention to those things. If you do have tenderness and pain increase after the cupping session, usually the next day is most of the time due to sitting still. You're lying still at night and then it tightens back up. So making sure that you continue to move and stay hydrated, and you may even want to include a detox tea to drink during that recovery period afterwards. Those cupping marks can last for a week to 2 weeks. In normally well-perfused skin, within a week's time, a lot of the cupping marks will be gone. But if you have severe stagnation, it can take more than a week to 2 weeks, sometimes even as long as a month for that to disappear. I'm adding more cups again. I've identified some restrictions in the spine, and I'm trying to loosen up the muscles along the spine. As we're going on, I'm talking with the patient. She's asking questions about different things that she can do to continue improving after the treatment. The cups are closer together now. I'm trying to tonify and strengthen, less emphasis on the moving and stretching part of it and more on the tonifying. But I'm always looking at the patient, looking to see what's going on. You can see even when I'm lighting the cups that I'm always watching the patient, looking for signs with them. You can see more of that redness along this outer edge here of the spine. And again, I am doing a little bit more of that moving cupping, just still trying to loosen some of the areas. And those skin discolorations, you can see even after I've moved the cup, you can see a few of the circles, and then as I drag the cup, you can see the circulation coming to the surface because of that suction. The light pink down here is just the circulation just moving back and forth, not particularly any stagnation going on. From a Chinese meridian theory standpoint, the areas that I'm working on this particular patient is the Du meridian. The meridians are the superhighways of your body, and the little spots that I stop at along the way, those are the acupuncture points or acupressure points. Again, moving them closer together, trying to tonify. I gently put my finger underneath the edge of the cup to loosen the suction, to remove the cups. You can see a little bit of the circles on the side here from some of the cups. You can see a couple little spots, and there's an area of redness in the upper back. That deeper red is that moderate stagnation, that things being stuck and toxins being drawn to the surface. I'm now massaging and just trying to get the tissue to go back. When you take the cups off, the tissue is still raised in little circles from the suction. So just trying to restore the natural circulation to the area, gently stretching out the areas that had the most significant tightnesses. They move a lot more freely after the treatment. The client is now giggling because she's so happy. If you've had long-term chronic pain, you can understand that reaction. It is a fast way to get things pumping and moving and circulating again. I like the fire cupping in particular because that heat adds an extra aspect to the healing process. It already helps to draw the circulation to the surface. The warmth feels good, so it engages your body's relaxation mechanisms. Your body is what's doing all the healing. I'm helping, yes, but your body's doing all the fixing. Generally, my acupuncture sessions last 45 minutes to an hour. It depends on what's going on with the patient, but for the most part, they're done within 45 minutes to an hour. If there's some time, the initial appointment takes about an hour and a half because I'm getting to know the patient. I'm asking questions about their history, what's happened before, what's happening now, what kinds of things do they experience in their body. The idea of healing with Oriental medicine is actually treating the root of the problem versus just giving you something to get rid of the symptom that's going on at the moment. So a lot of times we seek treatment because of the symptoms. The symptoms are the warning lights. And you can get medicines to kill the warning lights. But if you never address the underlying problem, then you continue to have more problems because you will get another warning light will come along, and until you start fixing the things that are happening, the warning lights don't quit. You can add more medicines and more treatments to try to stop them, but if you don't find the root of the problem, ultimately you're not going to be able to repair it. The patient was very relaxed and was able to move much better after they got up, and was quite surprised because the condition has been going on for more than 2 decades. So the patient was extremely satisfied with the treatment. And I did check with her the following day to find out if she was one of the patients that has that residual soreness or increase in pain levels the day after, and she did not. And I spoke with her again a week following the therapy, and the improvement continues.